Time now for our coronavirus Q&A. It's a part of our show where we turn to the experts to get some of your questions answered about the coronavirus. And today we are joined, as we are every Tuesday, with Dr. Ruth Berggren. Thank you so much for joining us, Dr. Berggren. I want to just start by asking you your reaction to the governor's announcement yesterday.
So I think it's premature for San Antonio. Texas is a big place. We have lots of different kinds of communities in Texas. There are places in Texas that have hardly seen any cases where the population density is very low. And I think resuming business is probably a very good idea and important for those places. San Antonio is different. We have a higher population density, and we're worried that this may be early.
Talk about what the health transition team put together and kind of the recommendations that you talked about. Obviously, it's a very long plan. We don't have time to go into all of it, but kind of what the highlights are. And I'm struck by the fact that there are markers in place for progress and then for restrictions to be put back in place.
That's right. So this team is largely composed of people who are doctors and public health experts, but also people with an ethics background. And what we did was strictly look at existing public health literature and guidance from places like the CDC, Johns Hopkins, to determine what activities present what kind of infectious disease risk and how do we factor that in. We thought a lot about what sort of indicators would guide us to when it's safe to come back out into society and start running business again. And, really this is purely based on science, data, and evidence and infectious disease risk. This is not about politics. And we came up with what I think are very good progress indicators, and there's 4 of those. And those indicators tell us when it's safe to move forward and to get rid of some of our restrictions. And we came up with 3 indicators that are warning indicators, that if we see those changing in a significant way, that's a sign that we need to retreat.
Give me an example of one of those. Give me an example of what one of those things that you're looking at.
So of the progress indicators, the first one is, have we had a sustained decline in new cases of COVID for 14 straight days? And good news, we are seeing a decline in COVID cases, but technically it's really only been 3 days since we've seen that decline without a bump up again. And we would like to see that be more sustained. Our committee would like to see that be more sustained before relaxing restrictions. Other indicators include making sure we have enough tests available for the community. And right now we have less than half or maybe half of what we actually need. We estimate that we need to be able to test 3,000 people a day. That doesn't come from thin air. That actually comes from Governor Abbott's recommendations, and it's adjusted for the population size of Bexar County, and it aligns with other scholarly indicators of what should be available in a population the size of San Antonio. We have 1,600 tests that we can do a day. We need 3,000. The next indicator would be, do we have the capacity to trace the contacts, identify who's sick, and then find out who they were in contact with? That requires a special kind of worker. That kind of worker doesn't require a fancy degree or lots and lots of education, but it does require that those people be trained and that they be led and organized. And we need 175 of those. They're not ready to go yet. The 4th progress indicator we do have, and that is a healthcare system that's prepared. We have the PPE, the protective masks and so forth that are necessary to take care of patients. We have hospital beds, we have ventilators, and we have ICUs. Thankfully, our healthcare system is not overly stressed at this time, and we've had time to prepare. So of the 4 progress indicators, there's really only one where we're on very solid ground.
Now, the health transition team is recommending reopening in phases. At least that's how I interpreted it when I reviewed it. Can you talk about those phases and what each of them means?
Right. So we're in phase 1 right now, which is stay home, work safe. And it's not exactly a full lockdown, but you all know what it is because you're living it every day. A phase 2 would be when we have those 4 progress indicators ready to go, as I just mentioned. And now we would recommend that businesses start reopening in a phased manner, in a staged manner, you would say, for phase 2. And those places that have an intermediate or high infectious disease transmission risk, they should open at a reduced capacity. There's some activities that we engage in that are pretty low risk, such as going to libraries. As long as social distancing guidelines continue to be maintained, libraries can reopen. Restaurants and places like that could reopen at, Governor Abbott says 25% capacity. I think our report suggested we open at 30% capacity, but that still includes checking the temperature of people coming to work. It asks people to wear masks when they're not actually eating. It requires all of the hand hygiene, social distancing so that you don't have too many people in one place, and people, to the best extent possible, need to be remaining 6 feet apart from each other. When that happens, we need to be monitoring what's going on in the city. We need to see, are the number of cases going up? Are we suddenly seeing an increase in the percentage of people that are getting tested being actually COVID positive? If those sorts of things start to happen, if we start seeing a decrease in the time it takes to double the number of cases, or if we start to see our hospital system being stressed, those 3 warning indicators need to be reviewed by our team, and we need to come up with guidance about either retreating to the prior phase or at the very least recommending holding off before we expand further.
Yeah, absolutely. All right, Dr. Ruth Berggren from the UT Health San Antonio, the Long School of Medicine. We will see you tonight at 9 o'clock during the news at 9. And of course, then we'll take segments of that run it at 10. Thank you, Dr. Berggren.
Thank you.
We'll be right back.
Separating fact from fear and some of the fiction that is out there. It's what we try to do every night with this coronavirus Q&A, where we take your questions to some of the experts. And we are pleased that most Tuesday nights, I think 4 or 5 Tuesday nights in a row, we have had Dr. Ruth Berggren, the Long School of Medicine at UT Health San Antonio. We are thrilled that she is back with us. Dr. Berggren, you're also a member of the health transition team. So
I am.
I know that, the county and the city was hoping maybe some leeway would be coming from the governor's office when he put down his restrictions. Your reaction to what the governor had to say on Monday?
Yeah, so I'm happy that there's a plan for phased return to business, but I think that implementing it right now is too soon for San Antonio. And I say that based not just on the opinion of our health transition team. One of the metrics comes right out of Governor Abbott's recommendations. I mean, he recommended that Texas should have the capacity to test 30,000 people a day. And if you adjust for the population of Bexar County, we should be testing 3,000 people a day here to be safe to open, according to Governor Abbott. Well, in actuality, Steve, we're only testing 1,600 people a day. So we have a long way to go to get to the metric that Governor Abbott himself said we ought to reach. And there are other issues as well. We need to be able to contact trace. And fortunately, we do have the capacity within our healthcare system to take care of patients. We have the ventilators and the beds and so forth, but gosh, we don't really want to go there. And so this is too early for us.
Talk about the big difference that I noticed between what the governor laid out on Monday and what I saw in the city and the county's plan, were that there are definite metrics in the health transition plan for when we can move forward and when we need to pull back. Is that the biggest difference that you see as well?
Yes, but also the issue of masking. And we have very strong recommendation that's aligned with the CDC's recommendation that everybody actually over the age of 2 should have a mask on when they go out in public. And the governor's plan does not mandate this. There's a lot of discussion recommending masking, but there's no plan to enforce it. And it really opens the door for people to disregard that recommendation altogether, and that's a concern.
Yeah, but there are thresholds in the city and county plan that we can cross moving forward or that we need to pull back with.
Right. And, one of the first ones I didn't mention yet, of the 4 that relate to moving forward, I think perhaps one of the most important things is we're supposed to have had a 14-day sustained period of declining cases. That means for a 14-day period, every day there's fewer cases than the day before. And technically, we're at day 3 for that right now. There's a more liberal interpretation. If you just disregard one of the bumps we had recently, you can go back maybe a few more days than that. But we're certainly not at 14 days, and we'd like to be there. And then once we do get started, Steve, there are thresholds for retreating. And those would include things like if we start to see that the percentage of positive cases of the people that are getting tested, the percent that are COVID positive, if that starts rising, that's of great concern. And that would be one of the indicators that would cause us to move back. Of course, overwhelming the healthcare system, running out of PPE, that would be another reason to move backwards.
Great. All right, let's get to some of the viewer questions that we have tonight. The first one, how will we truly know when it's safe to go out without our masks and try slowly to get back to our lives again?
Right. Tough question. And that's why we have all these metrics, progress indicators, and warning indicators. Right now, it's not safe to go out without your mask on. We still have community transmission. And if we suddenly take off our masks and go outside and interact with each other, we're just going to be back to square one. So, if we can meet these thresholds that we talked about of the sustained decline in cases, the capacity for testing, the capacity for contact tracing, if all of those things are met, then it's going to be safer. And we can move into what we would call on our transition team a phase 2, where businesses are opening at reduced capacity, initially 25 to 30%. And then after a 2 to 4 week period, if everybody's doing well, if we aren't seeing warning indicators, and if people are actually doing what they're supposed to be doing in their business places with social distancing and cleaning environmental surfacing, if that's happening after 2 to 4 weeks, then we expand again to an intermediate level. And then 2 to 4 weeks later, again, if all goes well, we expand to close to full capacity.
Great. Next question. I tested positive for the coronavirus and am self-isolated. How do I know when it's safe to come out of isolation? Should I be retested?
Okay, so there are really good guidelines for that, and you can find them at cdc.gov. And the guidance would depend on whether you were symptomatic or asymptomatic. So let's imagine that you got tested for whatever reason, maybe because you were close contact with somebody at work, and you were found to be COVID positive, but you never had any symptoms. How long do you have to stay isolated? The answer is 10 days. However, if you got your COVID test because you had symptoms of COVID, then you need to go home and isolate. You've got to be home for a minimum of 7 days from the time you tested positive. Plus, you have to have had no fever for 72 hours. And your symptoms have to be getting better. They don't have to be all gone, but your symptoms have to be significantly improved. So different standards for coming back to work depending on whether you're symptomatic or asymptomatic with your COVID-19.
Great. Next question. Another person, I tested positive for the coronavirus. So far, my husband remains asymptomatic. Should he be tested before returning to work?
So he should certainly be quarantined for 14 days. If he wants to get back to work sooner than that, then he should be tested. But remember, if you're still shedding the virus, your husband is exposed to you every day, and so he could still become symptomatic. So the test for him would really only help if then you are separated and he's no longer exposed to you. But the bottom line is someone who is asymptomatic but is a close contact of someone with known COVID, that person should quarantine for 14 days, and that means quarantining away from the sick person before they go back to work.
All right, next question. With some restaurants set to reopen, is it actually safe to take my family out for dinner this weekend? I kind of think this is a judgment call because all restaurants are not created equal. So I'm going to change this one to what should I look for in a restaurant that I'm going out to? What sort of safety measures do you think people should be looking for when they walk in the door of a restaurant?
Well, we've already said that, our transition team has looked at these criteria, and San Antonio hasn't met those criteria yet. So we wouldn't say that it's safe. But what you should look for is how well is the restaurant adhering to the guidelines that exist, the safety guidelines. And one thing is there hand sanitizer around? When you walked in the door of that restaurant, first of all, was there a crowd of people? Was there an effort being made to keep people 6 feet apart from one another as they're entering the restaurant? Was there a place to wash your hands or sanitize your hands? When you sat down, How far away were you from the other people? Was your waiter or your host or your hostess wearing a mask? And were the menus disposable? That's one of the guidelines for restaurants, Steve, is that we should not be passing menus from person to person. And ideally, the guests should be remaining masked until it's time to eat. So until they're seated, certainly, all the guests should be masked. Those are some of the basic things you want to be looking for.
It's a whole new world we're moving into here. Okay, a question that I had is about some of the things they're seeing in Germany right now. They are very concerned about a second wave, about a return of some of the cases of COVID there. Are you following that? Is that also your concern about what we may see in the United States?
Absolutely. Germany has been very proactive about being evidence-based. They're listening to their scientists. And when they relaxed the restriction, they started to see new cases surge. Of course, that can happen here. And, we talked about how we flattened the curve and we've had just a few meandering peaks, or people talk about maybe we peaked last week. If we relax all our restrictions and we go back to the way we were before, we will have a big surge. And all of these so-called peaks that we've seen will be like little foothills. So we need to be really careful. And we need to know that we're moving into phase 2 for good reasons, and we need to make sure we understand what the guidelines are for staying safe in phase 2.
Absolutely. All right, want to give you the last word like I always do, Dr. Berggren. What are you going to leave our viewers with tonight?
Okay, we can do this, San Antonio. We can do it, but it requires working together, it requires teamwork, and it requires caring about each other. And I would recommend that businesses by sector form groups, affiliation groups, and that they coach each other. If one particular enterprise within a sector is struggling, then the other businesses should come to the aid, help share the hand sanitizer, share the best practices, work together as a group, because it's not about individuals competing for business. This is about helping our whole economy get back on its feet so that we can be healthy in all ways, economically prosperous and physically healthy as well. We have to work together. We've got to be a team.
Dr. Ruth Berggren, UT Health San Antonio, always appreciate it. Thank you.
Thank you, Steve.
We'll be right back.